The best way I think about disease is to split the word into two, dis-ease. We have known for the last 150 years this word homeostasis, which basically means balance. When the body is working in balance, whether it's how every organ is working, how the pH of the body is in balance, the foods that we eat are right for the body. So when the body is in balance, it's in a state of ease. And in a state of ease, you don't get sick. You can get colds and flus, but I mean, you don't develop chronic disease. However, when the body is continually exposed to different factors, whether it's the wrong food or different types of toxicity from pollution or smoking, or you're in a job that you don't like, or you're in a relationship that is not conducive to your well-being, those types of things definitely will contribute to the fact of putting the patient out of balance. And the more you are out of balance, the more the body will have to try and react against it. And when it reacts against the state of dis-ease, it starts to tell you that there's symptoms. So I believe that the symptoms that the patient expresses is not their problem. It's the reason that they often will come to the doctor. But it's only an indication that they're out of the state of ease, they're in the state of dis-ease. And if they simply attempt to treat the symptom, what they do is they miss the opportunity for really, what is the body trying to tell us? You know, the common example is if somebody has a headache, they take Tylenol or some type of medication like that, and their headache gets better. One would make the assumption that the headache must have been due to a Tylenol deficiency, which of course it wasn't. And so while you may not feel the symptom, you still haven't addressed the problem of why the person has the headache. And if you allow that to perpetuate and continue, the state of dis-ease will continue to be created imbalance, and we will get further and further chronic disease. So our goal as physicians is to try and help the person understand what are the real reasons that a person may be in this state of disease. And it goes back to the last question of what are the types of things they can be doing for themselves. And very often we don't have to look, that may be the wrong food for them, they're not doing enough movement, they don't drink enough water, they're not getting enough sleep, they're not able to manage their stress effectively. Those often are the things which push us into disease, and then the body gets out of balance from the endocrine system or whatever the particular presentation is in the patient.